Good morning, everyone. I'm Dr. Philip Taah-Amoako from Ghana, a member of the Ghana College of Surgeons, and also hold an MSc in Surgical Science from the University of Edinburgh, Scotland. So I'll be talking about the prevalence and management outcomes of diverticular disease in a tertiary facility in Ghana. By way of introduction, diverticulosis is the presence of diverticula and is often detected incidentally in patients who undergo endoscopic or radiological investigations. And that's basically because diverticulosis is usually asymptomatic and thus is detected incidentally. Due to that, the true prevalence and incidence of diverticulosis is generally unknown in the population. So in sub-Saharan Africa, we regard diverticular disease as non-prevalent, so we do not actively seek it. But then the exact burden, because of this, has generally been unclear, and thus we don't have a lot of studies going into it. But over the years, interest have grown in diverticular disease. Our interest in diverticular disease stems from the fact that there had been four studies on the condition in Ghana, the first of which was done in 1978 by Champon et al., who looked at 362 endoscopic NMS over a 3-year period spanning between January 1974 and December 1976. In his study, there were no cases of asymptomatic diverticulosis. 16 cases were radiologically proven diverticular disease, and an incidence of 3.9% was recorded. Then in 1997, a prospective study over 3 years was done by Bakun et al. He found 37 patients with diverticular disease. Rectal bleeding was the commonest presentation. This was followed by Dakubo et al. In 2000, who did a retrospective study and saw 596 patients who had undergone a colonoscopy. In his study, he sought to determine the frequency of benign lesions and carcinomas in patients who underwent lower GI endoscopy due to rectal bleeding. And his study found that 4.5% of those he studied actually had diverticular disease. So Mason et al. Followed this up between 2003 and 2007. He sought to emphasize the role played by double contrast barium enema in the investigation of patients with colorectal symptoms. And so he reviewed double contrast barium enemas in Kolebu Teaching Hospital between 2003 and 2007. And in his study, he realized that the commonest pathology that was diagnosed was diverticular disease, which accounted for 23.91% of the patients he had studied. In sub-Saharan Africa, generally, as I said, diverticular disease is non-prevalent, so we do not actively look for it, and therefore the exact burden is really unclear. So, we sought to determine the prevalence of diverticular disease in patients who are undergoing lower GI endoscopy at the Kolebu Teaching Hospital. A snapshot period of 3 years spanning between January 2017 and December 2021. And we wanted to determine the common presentations of symptomatic diverticular disease among inpatients also on the surgical units to assess the outcomes of the various therapeutic interventions employed. So it was a retrospective cross-sectional study in 2 parts. The first part recorded reviewed records of patients who undergoing lower GI endoscopy to determine the prevalence of diverticular disease. And the second part reviewed the records of patients treated for symptomatic disease in the general surgical units of the Kolebu Teaching Hospital to assess the outcomes in terms of mortality from these interventions. So we looked at a population of 4,266 patients who underwent lower GI endoscopy. And the number that were diagnosed with diverticular disease from this investigation were 380 patients. And we found a prevalence of 8.91% from this population. 97.37 were from colonoscopy, and 2.63% were from pectoral sigmoidoscopy. With this current rate, we realized that it was an increase from that reported over a decade ago by Dakubu et al. He recorded 4.5%. And it, however, remained lower than that recorded in other countries. 42% recorded in the USA in 2013, 49% recorded in Germany, and then 23.9% recorded in Japan, and also 28.5% recorded among Thai adults in Thailand. An average of 86 cases were recorded per year, with a mean age of 67.02. The age range from 26 years to as old as 95 years, with an interquartile range of 16. The male-female ratio of 1.4:1 was also recorded. With this average cases per year, it was observed over the 5-year period that there was an increase from the previous 5-year period of 12, which documented 12 per year by Champon et al. And then by Dakubu et al. Previous, respectively. So, as we indicated earlier, that from a Champon et al. Recorded a 5 case per year over his period, and the Champon Bako et al. Also recorded 12 per year over that period. The average age of 67 years was similar to other African studies, and we into that in the US, which also stood at 67. So, though the disease was known to be a disease of the elderly, this study showed a young patient as young as 26 years being diagnosed of the condition. In Zambia, the youngest patient documented was 42 years, and in Sudan, the youngest patient recorded was 17 years. However, the youngest patient ever documented with the colonic diverticulosis was that documented by Ignacio Alshi Jr., and that was a 9-year-old patient with Williams syndrome. He presented with rectal bleeding from sigmoid diverticulitis. So, with this, we want to talk about the trend of diverticular disease over the 5-year period we studied. So, over that period, we realized that there was a gradual increase initially, but due to the global pandemic COVID-19 in the latter part of 2019 going into 2020, there was a drop in the number of cases and the number of colonoscopy generally done, and thus the number of diverticular diseases diagnosed. But then there was a sharp rise subsequently in 2021. So, by way of indications for colonoscopy, bleeding per rectum was the commonest indication. It accounted for 60% of cases that were done. Change in bowel habit accounted for 7.89%. Colorectal mass accounted for 6.58%. Abdominal pain 5.5%. And then other conditions accounted for 20%. And this was a little different from that in Thailand, where change in bowel habits was the commonest indication for colonoscopy. And abdominal pain, especially in the left iliac fossa, was the commonest indication for colonoscopy in Sudan. And in Nigeria, like in Ghana, rectal bleeding was the commonest indication. By way of location, 39% were in multiple sites, 22.89 were in the left colon and sigmoid colon, 12.11 were in the right colon, 4.47% of cases were in the transverse colon, and then 21.2% did not have their sites specified. Compared to other studies in European and North American studies, the left colon accounted for the most common sites of diverticular disease, as much as 86%. Japan and Korea, the right colon were the commonest sites, accounting for 75 to 85%. And in Thailand, the right colon was the commonest site documented. In Sudan, it was the left colon. And like in Ghana, Nigeria had more pancolonic cases. In the second part of the study, we looked at patients who were admitted with symptomatic diverticular disease. Presentation were generally bleeding per rectum, which accounted for 94.32%. Acute diverticulitis recorded a minor 5.6%. There were 88 admissions on account of complicated diverticular disease, which involved 67 patients. Five of these patients were admitted multiple times, and one patient had a total of 19 admissions. And in all these admissions, he was managed conservatively. The average age for admission was 69.26, and the age range between 40 and 98, with an interquartile range of 20. There were more males again, with a male-female ratio of 1.9:1. By way of management, most of them underwent conservative management. 89.77% were managed conservatively with intravenous antibiotics, intravenous fluids, and for those with bleeding, they were hemotransfused. Surgically, 10.22 underwent surgery, and 3.41 had total colectomy with ileorectal pouch anastomosis. 2.27 had a hemicolectomy, and one had a sigmoid colectomy, and there were 3 hemorrhoidectomies. Conservative management generally is advocated, but with the use of antibiotics, the paradigm shifts. The paradigm has been challenged. In 2 randomized clinical trials, the AVOD and the Diabolo trial, they compared antibiotic usage and non-antibiotic usage in immunocompetent patients and non-septic patients with uncomplicated diverticulitis. For them, there was no difference in time to recovery from the initial episode or in-hospital stay. In complicated diverticulitis, they concluded that little evidence exists about the antibiotic treatment in their study. From our study, the average length of stay was 5 days, with a maximum length of 22 days. Mortality was 7.5%. Of the 5 patients, the 5 mortalities recorded, 1 had undergone a surgical intervention and 4 were managed conservatively. Mortality risk with surgical intervention was 11%, and the risk with conservative management was 6.9%. So there was a 1.6 times relative risk of mortality after surgical intervention compared to conservative management. And colonic diverticular hemorrhage, generally we got to know that resolves spontaneously in more than 90% of cases. But then elective surgery after 1 or more episodes of diverticulitis may improve the quality of life, but this should be individualized and based on the frequency of recurrences, duration, and the severity of symptoms after the attack, and maybe the presence or absence of comorbidities. In conclusion, this study showed an increasing prevalence of diverticular disease in our population. It also raises the fact that it occurs in a great proportion of elderly people. And then bleeding per rectum was the commonest presentation from our study. There was also a 7.5% mortality with symptomatic diverticular disease, and a 1.6 times higher. It was 1.6 times higher in those who had surgical intervention. So thank you very much, and I would like to acknowledge the efforts and contributions of my co-authors, Professor Bediako Bowen and Professor Jonathan Dakubu, and also the support of the leaders of the surgical unit of the Kolebu Teaching Hospital and the staff of the endoscopy unit of the Kolebu Teaching Hospital. Thank you very much for your attention. Thank you.